Well, for those of you who don't know me, I'm Dr. Singh, internal medicine in the Texas region, but I also play a role throughout the company. Today, what we're going to attempt to do is give a quick 5 to 6 minute discussion on stroke management and what we're doing at CNS. Now, again, this is a 30,000-foot view. Unfortunately, it takes years to really be able to kind of discuss exactly what we do at CNS, but we're going to make a good attempt here today. So one of the first questions I always ask patients whenever they come to us and I meet with them for the first time is, what brought you to CNS? And the reason this is such a powerful question is because it allows me the opportunity to get an idea of why they are here and their understanding also of why they are here. Oftentimes I get answers from them, well, I'm here for the excellent therapy. And I always say, yes, I agree, we do have excellent therapy here, but what brought you the need to come here for therapy? And it's often, I'm very saddened, by their response, because most of the time they really don't have an idea as to why they're at CNS, particularly with their strokes. So what we're going to do today is kind of discuss a little bit of the stroke, the three main types of stroke. And these are the things that I usually educate the patient with. And I feel this education is important for all of us as well. So I want you guys to remember this acronym, the. T stands for thrombotic strokes. And these are strokes that actually happen localized in the brain. These are blood clots that happen in the arteries of the brain. Hemorrhagic strokes, these are blood vessels that supply the brain that rupture and bleed. And embolic strokes, these are blood clots that form in another part of the body and travel to the brain. So I have a little throwback here to the Matrix. Let me tell you why you're here. And this is often one of the discussions I have with patients, is to give them the idea of what caused their stroke. So when it comes to localized strokes that are happening just in the brain, these are thrombosis. Diabetes, hypertension, high cholesterol, laying those plaque burdens down in the brain, oftentimes cause blockage there that prevents blood flow from going down to the further part of the brain. And the next one are hemorrhagic strokes. And these are strokes that happen from aneurysms or uncontrolled high blood pressure. And what can happen from these is they end up causing weakening of the structure of those vessels and a rupture. And that can lead to the bleed in the brain. The good news is about 13% of the patients that have strokes have these types of strokes. They're more difficult to manage than the others. And then again, AV malformations, these are congenital things that happen, that patients, unfortunately, they're kind of like a ticking time bomb and it can just rupture at any point in time. And lastly, embolic strokes mostly are cardiac in origin and can happen from cardiac arrhythmias, and also can happen from postoperative complications from cardiac surgery. So as you can see from this slide, there are a lot of different causes of stroke, and we just touched on some of the main ones here. So what I always tell patients is, we cannot change what's happened in the past. However, we can just focus on what we can do going forward. And as you can see, preventing the next stroke requires a very holistic evaluation of the patient. And this is something that we strive to do in the medical department at CNS. So as you all know, we have a very unique product at CNS company-wide, and this is a multidisciplinary medical approach and therapy approach that we take for our patients. I've highlighted the team members here, and of course, therapy is the main pillar of our care, but the nursing department, case management, counseling, education, internal medicine, PMR, and neurology, neurosurgery, and cardiology, hematology, on occasion, we do have to get those individuals involved. This is a busy slide, so forgive me, we'll work through it. Part of the medical management at CNS is involved with workup. Again, keep in mind, we're trying to get to that ultimate answer as to what caused the stroke and how we can prevent that from happening again. So each patient that comes through CNS, they will have a full medical evaluation and assessment. And that will lead us to some of the answers that may be why they've had this stroke. They generally will get labs if they haven't had any recent labs done at the previous level of care, and those will include some of these that you see here on the screen. They will also obtain diagnostics from time to time, updated CT scans, MRIs of their head, vascular studies to give us an idea of how their kidneys are working, how their cardiovascular system is functioning. Sometimes they'll require cardiovascular workup where they will have a Holter monitor attached to them to identify whether or not they're having any type of arrhythmia. And then we go to the treatment section. And again, of course, this is limited with 30,000-foot view, but there's a whole slew of medications that we can prescribe patients. And these are to help to control their diabetic conditions, hypertension, cholesterol, and getting their blood thinned if they've particularly had embolic strokes before. Now, the goal in mind is to get these patients to certain levels during their stay with us is the preference, but eventually to get down to this goal. So I've highlighted here, LDL of less than 70 is a goal, blood pressure goals, and A1C for diabetes reduction below 6.5 is also very important. I can proudly say that we have been able to accomplish a lot of these within 2 to 3 months of the patient being with us. So this is unheard of even outside of CNS. So I applaud our team for being able to get ahead of these. On occasion, patients will have to go back for surgical procedures, cranioplasty, or orthopedic procedures, cardiac closures that are done minimally invasive, and neurointerventional procedures. The important thing here is some of these treatments need to be done urgently while they're with us at CNS, but then the medical team works very closely with the entire team to decide if some of these procedures can hold off until after they've completed the therapy and they've gotten a little bit stronger. I always tell patients it's best to optimize your therapy, get stronger before going and doing some of these invasive procedures. It just helps them for a better recovery. Ultimately, our goal is prevention and reduction of the effects of their medical comorbidities. So if their diabetes is uncontrolled, control it. If their high blood pressure is out of control, let's get them on the right medications and optimize them to be able to fulfill their needs and get through their therapy. And lastly, but not leastly, is therapy on here. So for those of you who have seen patients with me in Dallas, I always tell patients, your #1 prescription for your stroke at CNS is your therapy. And so our goal as the medical team is to keep patients in therapy. So we have to control their medical issues, make sure that their blood pressures are controlled, their blood sugars are doing well, so that they can optimize and spend the most time in therapy so that they can recover from their stroke. So to summarize, I kind of put this statement together. At CNS, our medical approach to stroke management includes a multidisciplinary approach that includes controlling the medical comorbidities to allow optimization of time in therapy. By identifying the etiology of a patient's stroke, we equip them with the knowledge and valuable tools that minimize the risk of future strokes. And I believe that statement is very powerful there, because if we can empower a patient with the understanding of what brought them to us at CNS, not only will they be able to take that education along with the therapy and the new approach to their new life with them, but they now are armed with that understanding of how they can combat further risk factors for them in their stroke. So I know that was a quick 30,000-foot view of what we're doing medical management wise.
Background screen.
So thank you so much.